If you're over 60 and taking a statin medication like Lipitor, Crestor, or Zocor to manage your cholesterol, what I'm about to share with you today might completely change how you think about these widely prescribed drugs, because recent research has revealed some truly surprising facts about statins and seniors that your doctor may not have discussed with you. And understanding this information could be crucial for making informed decisions about your health and longevity in your golden years. My name is, and after spending over 2 decades researching cardiovascular health and working with thousands of seniors who have navigated the complex world of cholesterol management, I've discovered that the relationship between statins, cholesterol, and health outcomes in people over 60 is far more nuanced and controversial than most people realize. And today, I'm going to share with you the latest scientific evidence, the hidden risks that many seniors face, and the surprising alternatives that leading cardiologists are now recommending. Now, before we dive into this important discussion, I want to make it absolutely clear that I am not telling anyone to stop taking their prescribed medications, because any changes to your medication regimen should always be made in consultation with your healthcare provider. But I do believe you have the right to know about all the latest research so you can have informed conversations with your medical team about what's best for your individual situation. What might shock you is that some of the most prestigious medical institutions in the world, including the Mayo Clinic, Johns Hopkins, and Harvard Medical School, have published studies questioning whether the benefits of statins for seniors, particularly those over 75, outweigh the risks. And this represents a dramatic shift from the widespread enthusiasm for these medications that dominated medical practice for the past 3 decades. Dr. Beatrice Golomb from the University of California, San Diego, who has conducted extensive research on statin side effects, has documented that seniors are particularly vulnerable to adverse reactions from these medications, including muscle pain, cognitive impairment, increased diabetes risk, and even potential impacts on longevity. Yet many seniors are prescribed statins based on guidelines that were primarily developed using data from younger populations. The story I'm about to tell you illustrates why this matters so much. Meet Dorothy, a vibrant 78-year-old grandmother from Michigan who had been taking Lipitor for 12 years after her doctor prescribed it following a routine physical that showed her total cholesterol was 240, which was considered high according to standard guidelines. But what Dorothy didn't know was that her HDL cholesterol was exceptionally high at 85. Her triglycerides were normal, and she had no other risk factors for heart disease, no family history of cardiovascular problems, and she exercised regularly and maintained a healthy weight. Over the years, Dorothy began experiencing what she described as feeling like her mind was wrapped in cotton, with memory lapses that concerned her family, muscle aches that made her daily walks increasingly difficult, and a general sense of fatigue that she attributed to normal aging. But when a new cardiologist reviewed her case and suggested a trial period off the statin under careful monitoring, Dorothy's mental clarity returned within weeks, her muscle pain disappeared, and she felt like herself again, leading her to wonder why she had been prescribed this medication in the first place and whether the cure had become worse than the disease. Dorothy's experience reflects what researchers are calling the statin paradox in seniors, where the very medications prescribed to extend healthy life may actually be reducing quality of life and potentially even shortening lifespan in certain populations, particularly healthy seniors whose only risk factor is an elevated cholesterol number that may not actually indicate disease risk when viewed in the context of their overall health profile. Dr. Harlan Krumholtz, a cardiologist and researcher at Yale University, has published groundbreaking research showing that for seniors over 75 who have no history of heart disease, the evidence supporting statin therapy is remarkably weak, and in some cases, slightly higher cholesterol levels may actually be protective, correlating with better cognitive function, stronger immune systems, and even increased longevity, which completely contradicts the lower is always better approach that has dominated cholesterol treatment for decades. The cognitive effects of statins in seniors have become a particular area of concern, with multiple studies documenting cases of memory loss, confusion, and what patients describe as brain fog that can be mistakenly attributed to normal aging or even early dementia, but which resolves when the statin is discontinued. And the FDA has now required manufacturers to include warnings about cognitive side effects on statin labels, though many seniors and even their doctors remain unaware of this connection. Dr. Dwayne Gravelin, a former NASA flight surgeon and aerospace medical research scientist, wrote extensively about his own experiences with statin-induced cognitive impairment, documenting 2 episodes of transient global amnesia that occurred while taking Lipitor. And his research revealed that the brain, which is 25% cholesterol by weight, may be particularly vulnerable to the cholesterol-lowering effects of statins, especially in older adults whose brains may already be experiencing age-related changes. The muscle-related side effects of statins, known medically as statin-associated muscle symptoms, or SAMs, affect an estimated 10 to 25% of all statin users, but the incidence appears to be even higher in seniors, particularly those over 70. And these symptoms can range from mild muscle aches to severe muscle breakdown called rhabdomyolysis, which can be life-threatening and may be more likely to occur in seniors who are taking multiple medications that can interact with statins. What's particularly concerning is that many seniors who experience muscle pain while taking statins are told that the benefits outweigh the risks and are encouraged to continue the medication. But emerging research suggests that statin-induced muscle damage may contribute to frailty, falls, and loss of independence in seniors, raising serious questions about whether the cardiovascular benefits, which may be minimal in healthy seniors, justify these risks to mobility and quality of life. The diabetes connection has become another area of significant concern, as multiple large-scale studies have confirmed that statin use increases the risk of developing type 2 diabetes by approximately 10 to 12%, and this risk appears to be highest in seniors, particularly women over 65. And given that diabetes itself is a major risk factor for cardiovascular disease, the irony of prescribing a medication to prevent heart disease that may actually cause another condition that increases heart disease risk has not been lost on many researchers and clinicians. Dr. Naveen Sattar from the University of Glasgow, who has extensively studied the statin-diabetes connection, has calculated that for every 225 people treated with statins, 1 case of diabetes will be caused. And while proponents argue that the cardiovascular benefits outweigh this risk, critics point out that this calculation may not hold true for healthy seniors who have a very low baseline risk of cardiovascular events to begin with. The liver effects of statins, while less common than muscle and cognitive symptoms, can be serious and may be more likely to occur in seniors who are already taking multiple medications that stress the liver. And regular monitoring of liver enzymes is recommended for all statin users, but many seniors are not aware that they should be having these tests or what the results mean for their continued use of the medication. Perhaps most shocking of all is the emerging research on statins and cancer risk, with some studies suggesting that very low cholesterol levels, which are often the goal of statin therapy, may be associated with increased cancer risk, particularly in seniors. And while the evidence is still evolving, researchers like Dr. Harumi Okuyama from Nagoya City University in Japan have argued that the aggressive lowering of cholesterol in seniors may do more harm than good by compromising immune function and cellular repair mechanisms that help protect against cancer. The CoQ10 depletion caused by statins is another serious concern for seniors, as these medications block the same pathway that produces coenzyme Q10, a crucial nutrient for cellular energy production and heart health. And while younger people may be able to compensate for this depletion, seniors who already have declining CoQ10 levels due to aging may experience significant fatigue, muscle weakness, and even heart problems when statins further reduce their CoQ10 levels. Yet many doctors do not routinely recommend CoQ10 supplementation for their statin-taking patients. Dr. Peter Longjean, a cardiologist and CoQ10 researcher, has documented numerous cases of seniors who experienced significant improvement in energy and muscle symptoms when they began supplementing with CoQ10 while taking statins, and his research suggests that CoQ10 depletion may be responsible for many of the side effects that seniors experience on these medications, raising questions about whether routine CoQ10 supplementation should be standard practice for all senior statin users. The issue of polypharmacy, where seniors are taking multiple medications that can interact with each other, becomes particularly relevant with statins because these drugs are metabolized by the same liver enzymes that process many other common medications used by seniors, including certain blood pressure medications, antibiotics, and even grapefruit juice. And these interactions can increase the risk of serious side effects while reducing the effectiveness of other important medications. What's truly eye-opening is the recent research on cholesterol and longevity in seniors, with multiple studies showing that people over 70 with moderately elevated cholesterol levels actually live longer than those with very low cholesterol levels, a finding that directly contradicts decades of medical teaching and suggests that the aggressive cholesterol targets that are often set for younger adults may not be appropriate for seniors. The Honolulu Heart Program, which followed over 3,500 men for nearly 2 decades, found that those with low cholesterol levels had significantly higher death rates from all causes. And this protective effect of higher cholesterol in seniors has been confirmed in multiple other long-term studies, leading some researchers to demonstrating that this eating pattern, which emphasizes olive oil, nuts, fish, vegetables, and moderate wine consumption, can reduce cardiovascular events more effectively than statin therapy in many populations. And unlike medications, this approach provides additional benefits, including improved cognitive function, reduced cancer risk, and enhanced quality of life. The importance of muscle mass preservation in seniors cannot be overstated, as sarcopenia, or age-related muscle loss, is a major predictor of falls, fractures, disability, and death in older adults, and any medication that contributes to muscle weakness or pain, as statins can do, may actually increase overall mortality risk, even if it provides some cardiovascular benefits, creating a situation where the cure becomes worse than the disease. The social and psychological aspects of statin therapy in seniors are often overlooked, but many older adults report feeling anxious about their cholesterol numbers and becoming overly focused on medical measurements rather than overall wellness and life enjoyment. And this medicalization of normal aging processes can lead to decreased quality of life and increased healthcare utilization that may not improve health outcomes. The legal and ethical issues surrounding statin prescribing in seniors are becoming increasingly important as patients and their families begin to question whether doctors have adequately informed them about the risks and benefits of these medications, particularly in light of emerging research showing minimal benefits and significant risks for many healthy seniors. And some medical ethicists argue that prescribing statins to healthy seniors without thorough discussion of alternatives may violate the principle of informed consent. As we look toward the future of cardiovascular care for seniors, the trend is moving away from the one-size-fits-all approach of prescribing statins based solely on cholesterol levels toward personalized medicine that takes into account individual risk factors, genetic profiles, overall health status, life expectancy, quality of life goals, and patient preferences. And this individualized approach is likely to result in fewer seniors taking statins and more emphasis on comprehensive lifestyle interventions that address the root causes of cardiovascular disease. The message I want to leave you with today is not that statins are always bad or that you should immediately stop taking your medication, but rather that you deserve to have all the information necessary to make informed decisions about your health in partnership with a healthcare provider who understands both the benefits and risks of these medications and who is willing to consider alternatives that might be more appropriate for your individual situation as a senior. If you're currently taking a statin and experiencing side effects like muscle pain, memory problems, or fatigue that you've attributed to normal aging, I encourage you to discuss these symptoms with your doctor and ask whether they might be related to your medication. And remember that you have the right to question any treatment recommendation and to seek second opinions if you feel your concerns are not being adequately addressed. The most important thing you can do is to become an informed advocate for your own health. Ask questions about the expected benefits and potential risks of any medication you're prescribed. Understand what the numbers mean in terms of your actual risk reduction, and work with healthcare providers who respect your autonomy and support your desire to make informed decisions about your medical care as you navigate the complex landscape of senior health management in an era of rapidly evolving medical knowledge and changing treatment paradigms.